This Shine talk will cover the basics of what self-advocacy is and how it can be used to get the most out of your meetings and appointments. We will then look in more detail at some self-advocacy tools and techniques that can help healthcare appointments go more smoothly. This session is being run as part of Spina Bifida Awareness Week 2024. We are grateful that this Awareness Week is being sponsored by Shine's legal panel, Enable Law and Davis & Partners Solicitors. Self-advocacy is being able to communicate and stand up for the things that are important to you. It means knowing your thoughts and feelings, particularly what you need and want, and being able to communicate this to others. Self-advocacy means knowing your rights and your responsibilities and being able to speak up for them. It means being able to make choices about all the different things that affect you and that are important to you. The aim of self-advocacy is that you find out what you want and need, and then form and implement a plan to make it happen. Self-advocacy doesn't actually mean doing things totally alone, though. A big part of it is recognising when you need or want help and asking for it. The self in self-advocacy really refers to the fact that you are the one making the decisions. You are responsible for and in control of all the choices that you make. So where and when are self-advocacy skills important? The short answer is almost everywhere and almost all of the time. But particularly anywhere and any time decisions are made and things are done that affect you. There are some examples on the screen of the sorts of times and places where self-advocacy can be particularly useful, such as during assessments, making complaints, or any time decisions are being made that affect you. If you want or need something to be done or to be done differently, it's up to you to help make that happen. Nobody else knows exactly how you feel or what you think. It can be tricky to get the hang of at first, but it's important to learn how to tell people that you want or need something to happen or change. So why should we self-advocate? Self-advocacy skills are important because they help you to figure out what you want and need, what you can reasonably expect, and then how to make it happen. This gives you more control of your life and help you to make decisions that are best for you. We all need to make choices about our lives, big and small, short and long term, all the time. Self-advocacy can empower you, help you to stick up for yourself and help you with important decision making. Being able to assert your needs and share your concerns about your health and the care you receive is particularly important when it comes to managing complex conditions, where you're dealing with a lot of different specialists. Professionals are experts in their fields and each may have one piece of the picture, but you are usually the one with the fullest picture of your life and health. You have the most details about your medical and personal history. You are the expert on your own needs, experiences, difficulties and preferences. The motivation to self-advocate comes from hope, believing that things can improve and striving to make sure that they do. This can be difficult, especially if you struggle with thinking about the future, or if past experiences have made it difficult for you to trust that things can be better. Shine can help you explore how things could be improved for you and help create strategies to make that happen. We'll go into some top tips for self-advocating now. Number 1 is to keep detailed and organised records. Dedicating a filing cabinet or some boxes to securely storing and organising all your personal records and paperwork is often helpful. It's essential to keep your records organised in a way that's easy to use and keep up to date. Chronologically is often the easiest, but you could also have colour-coded dividers for different categories, for example health, benefits, etc. Try and acquire your own copies of important official documents like hospital discharge summaries, specialist consultation notes, psychologist reports, therapist recommendations, scans, etc. Keep copies of things you send and hold on to correspondence you receive back. You may want to send things by recorded delivery to prove postage or receipt. Build up a fuller picture of your health in your records by adding to the official documents. You might include specifics about managing your condition day to day, so descriptions and timing of symptoms, medications, etc. A diary of medical appointments. You could also include audio recordings or photos and videos to show the specialist things that happen outside of your appointment in your daily life. If you have phone conversations, record the first and last names of individuals you speak to, along with their job title and a reference number for the call, and the date and time it took place. Your hospital passport is a useful personal and medical summary document to have and keep up to date should you need to go into hospital. We'll discuss this in more detail later in the presentation. Ideally, let a trusted person know where all your records are and how to access them, and how you've organised them, just in case you need some help in the future. Tip 2 is to learn and keep learning. Getting informed and constantly building and updating your knowledge is important. Through Shine, you can access specialist information and resources. This could be from the information section on our website, or you can also call or email to get specialist advice and support. You can also ask the other professionals involved in your life and care, whether that's a neurosurgeon, SEND teaching assistant, benefits assessor. Try to learn from everyone. Ask them for recommendations for books, articles, leaflets, websites, videos, or even other people to speak to. Make notes to help you learn, jot down questions, highlight parts you want to know more about. You could then review the notes with the professional who recommended the reading or viewing material. Remember that you're entitled to the time and attention of the people involved in making decisions that affect your life. It might help you to learn about the professionals too. What is their role and experience and expertise? Who's in charge? Who can help you with what, when, and how? Tip 3 is to prepare for appointments. Bringing along a written agenda to each meeting and appointment can be helpful. Cover what you want to tell the professional, what you want to ask them, and what you want to happen. It's good to have a clear idea in mind for what you want to achieve in a meeting to help you plan what to discuss and to keep you focused. You could ask the professional what their aims are for the meeting and beyond if it's relevant. Professionals are knowledgeable and motivated, and they usually work best with people who are also informed and invested. Think of yourself and the professionals as a team working on a problem together rather than it being you versus the professional. If you're nervous, it can help to practice. Plan what you want to say and the points you need to make. You can write down as much as you need to help you remember and everything you want to share and ask. You can memorise your notes, but it's worth keeping them with you at the appointment in case you forget and to help keep you on track. To build your confidence, you could even practice what you want to say with friends or in front of a mirror. Tip 4 is to stay focused and organised during a meeting. Express and assert yourself clearly, calmly and firmly. You may need to be persistent to get results, so don't give up on things that are important to you. Say exactly what it is you want and explain why you need it. Don't raise your voice or shout, but do speak clearly, concisely and with confidence. Ask your pre-prepared questions and note down the answers. Listen to what the other person is saying and ask for as much clarification as you need to get to grips with anything you don't understand. Keep taking notes, writing down any actions, who is responsible for doing what and when, including what you're responsible for. At the end of the meeting, run through the action list so everyone is clear. For instance, you might say, so now you are going to refer me for an MRI and I should receive the appointment by X date. In the meantime, I will take this medicine and record these symptoms and I should come back to you if X, Y or Z happens. Remember to thank the person for their time and assistance. It's easy to forget, especially after a long appointment. In some instances, it might be appropriate to send a follow-up thank you note or email that summarises your understanding of the meeting and what will happen next. The thank you is polite, but the correspondence also acts as a reminder for any agreed actions and provides assurance that you both understand the meeting's result. The NHS website has some good tips about how to get the most out of a doctor's appointment. We'll share a link to that later in the presentation. The fifth and final tip is to learn the art of negotiating and how to balance trust and assertiveness. Professional expertise is important, but where a decision concerns you, your thoughts and opinions matter. Ask people to explain and try to keep an open mind about their answer, while not forgetting what it is that you want and need. Together, you can work towards solutions that balance what can and should be done, according to the evidence and expertise, but that also takes into account what you want, think, need, and can realistically manage. Sometimes you might need to negotiate and/or change your position in regard to what's possible and when. The balance between assertiveness and trust is hard, but it can get better with practice. If speaking up for yourself is something you find quite difficult because you struggle with confidence, it can be a helpful exercise to think of what you might say on behalf of a friend in the same situation. This can help you find the words and strength to say what you need to. An important thing that everyone will benefit from is accepting the possibility that you might be wrong on something. This is true of you, but also of the professionals. Sometimes there are clear rights and wrongs, but other times it may be more subjective, or a more complicated balance of benefits and trade-offs. Keep an open mind, but also remember that if you do need to compromise on something that affects you, you're entitled to know why. So just to summarise this introductory section on what self-advocacy is all about. Speak up for yourself and know you have the right and expertise to do so. Get informed and keep building your knowledge. Know who to ask for information and where to find resources. Make sure you understand all your rights and responsibilities. Find supportive people who can help you. That might be friends, family, professionals, including people from Shine. Problem solve. Anticipating and preventing problems is often easier than trying to fix things afterward, so plan ahead where you can. Ask for the help and support that you need, and keep asking till you get it. Even if you don't actually know what help is available, you can reach out once you notice a need or a problem. Take control of your life. Be proactive, informed, and assertive. On the left is a link to the fantastic NHS webpage, What to Ask Your Doctor, which has some useful information on questions that you might want to ask to get the most out of a medical appointment. In the middle is a link to a handy Hydrocephalus Association fact sheet about assertiveness, which might be useful for anyone who finds this difficult. And on the right is a link to a brilliant video from young advocate Abby Edwards, talking about self-advocacy being a state of mind. We can't show the video for copyright reasons, but it's worth checking out. Another useful resource is the information page on the Shine website about self-advocacy, and we'll share the link to that at the end of the presentation.
Now we've spoken about what self-advocacy is, it's important to know what you can expect when accessing healthcare services. For people with spina bifida, they're often key pieces of equipment or routines you have developed to keep yourself well and to maximise your independence. It is key to maintain these wherever possible. Key points around your rights to this include the rights to reasonable adjustments under the Equality Act of 2010. Healthcare providers, including NHS hospitals, are legally required to make reasonable adjustments for disabled people. This includes ensuring that wheelchair users have access to appropriate equipment and facilities. You also have the right to be treated with dignity and respect. NHS hospitals are bound by the NHS Constitution, which includes the right to be treated with dignity and respect. This includes ensuring that wheelchair users are treated equally and that their mobility needs are met without compromising their dignity. You also have the right to person-centred care. NHS guidelines emphasise person-centred care, meaning that the treatment and services provided must take into account the specific needs of the individual. The hospital staff should consult with you about your needs, preferences, and any additional assistance you may require during your hospital stay. Examples of self-advocacy might include having access to your wheelchair whilst you're an inpatient. The Equality Act 2010 ensures NHS wards make reasonable adjustments for disabled patients. And this includes that you're entitled to bring and use your own wheelchair for comfort and independence on the ward. If your wheelchair is customised, which most are, with specialist cushions and postural support, it is considered a piece of essential medical equipment. If a hospital admission is planned, you can discuss this with the team at your pre-op appointment and arrive in your wheelchair. or depending on the nature of your stay, it may be more appropriate to have someone to bring your wheelchair in after a few days once you're well enough to be getting out of bed. If you're admitted in an emergency situation, the priority will be getting to hospital as quickly as possible and addressing your medical needs. However, as soon as possible, let the staff on the ward know that you rely on a wheelchair for mobility. Clearly communicate your need to have your wheelchair available to you for the duration of your stay. It is possible to have a temporary wheelchair provided while you are in hospital. However, this may not always be appropriate as wheelchairs are fitted bespoke to you. Family, friends or carers might be able to support you by bringing in your wheelchair to the hospital, but hospital staff should be able to help you coordinate this with them. Another example of self-advocacy in hospital is ensuring access to pressure relieving equipment. Maintaining your skin integrity is important to anyone with spina bifida, and changes in your normal environment and routines can be a big risk factor for skin breaking down. If you usually use a pressure relieving mattress or cushion at home, it's vital that you have access to these things for the duration of your stay. If a hospital admission is planned, you can discuss this with the team at your pre-op appointment and check that this is in place on your arrival. If you are admitted as an emergency, then raise this with the staff as soon as possible. However, as part of your admission process, you should have a pressure ulcer risk assessment within 6 hours of your admission. This considers factors such as your age, your mobility, skin sensation, continence and your general health. They should also check your skin as part of this to establish if you have any current areas of breakdown at the start of your time in hospital. It can also be important to consider if it is right for you to have access to your own carers while you're in hospital. For some people who have regular care teams and complex care routines, this is important to consider. Under the Equality Act of 2010, NHS hospitals must make reasonable adjustments for disabled patients, which can include allowing personal carers into hospitals. This can be important in order to have continuity of your care and to provide familiar support. You can request your own carers, which might be family members or professional caregivers, to support you during your hospital stay. Having your own carer may help with specific needs such as mobility, communication or personal care routines. NHS staff must work with your carer to ensure care continuity and respect your established routines. Hospitals should allow reasonable access for your carer. This might be during feeding, toileting or personal care routines. Your carer's involvement should be considered part of your care plan, especially for people with complex needs. Where an admission is planned, this can be discussed and agreed ahead of time, although it's important to consider that this may not always be appropriate. For example, if you've had a surgical procedure and are receiving a high level of medical care, it may be more appropriate to wait for a few days for things to stabilise before your carers attend to deliver part of your care. Although of course they'll be able to attend to give you emotional support and reassurance. Where your carers do deliver any of your care on the ward, it's important that this is agreed and communicated clearly, agreeing who is providing what care so that nothing is missed, presuming that the other party is doing this. It's very important to be able to maintain your normal bladder and bowel routines during a hospital admission. Explaining your bladder and bowel management routines ensures your autonomy and helps avoid complications such as infections. This could be ensuring that you're able to catheterise every 4 hours if this is normal for you, or ensuring space and privacy to be able to complete your bowel washouts once a day. In order to navigate any of these situations, good, clear communication is key for all parties involved. Where there are planned periods in hospital, speak up as early as possible to ensure your needs will be met. This can reduce any physical challenges while in hospital, but also emotionally can reduce anxiety during an already difficult time. State your needs directly, be clear, concise about what you need, and avoid vague language. Remain calm and respectful. Firmly express your concerns while maintaining a respectful tone. Ask as many questions as you need to. Request clarification on treatments, procedures, and decisions that affect your care. This ensures you're fully informed and involved at every step. Use your support systems, family, friends, or carers, whoever you feel most comfortable with. Ask for written information to keep your records up to date, and consider escalation if necessary. Tools that can help you advocate for yourself are Shine's Hospital Passport. This is a written document that covers your past medical history, medication, your mobility and equipment needs, your pressure care needs, communication needs, and about your mental well-being. Having all of this written down can help you to feel more confident to speak up about your needs. This is available to download on Shine's website and can be completed by printing and writing on, or can be completed digitally. This can be then physically handed over to the nurse looking after you, or can be emailed to the ward. While we hope that you will always have a positive experience when advocating for yourself and that your requests will be actioned without difficulty, we know that sadly there can be times where things are more challenging. Services to support you when things are challenging include NHS Advocacy Services, or PALS, standing for Patient Advice and Liaison Service. PALS provides on-the-spot help with any concerns, questions or issues that you have while receiving NHS care. They aim to resolve problems quickly and informally before they escalate into formal complaints. Services include offering advice and support, liaising with hospital staff to resolve issues, providing information about hospital services, patient rights and care options. Should PALS not be able to meet your needs, the next step would be to escalate to the NHS Complaints Service. This process is more structured and involves a detailed investigation into your concerns. Services include investigating formal complaints about the care, treatment or services you received, providing a written response after the investigation is complete, escalating the issue if it cannot be resolved locally. This can sometimes involve external bodies like the Parliamentary and Health Service Ombudsman. Use the complaint service when you feel your issue was not resolved through PALS or informal channels. You want to raise a formal complaint about your care with the expectation of a documented investigation and response. The issue is more serious and may involve a potential breach of care standards. Shine has a great deal of information on the website, and you can contact us by phone or email if you have any questions or would like to know more.